I am Dr. Giovanni De Maria, and I am a cardiology consultant in Oxford, and my subspecialty is in interventional cardiology. That is a very good question. So I grew up in Italy, and both my father and my grandfather, they were both doctors, they were GPs. So I was kind of introduced very early as a child to the art of medicine. The reality is, joking aside, is that I was fascinated by medicine from, exactly from my childhood, and I kind of made this decision very early in my life. Specifically, my dad, he was a GP. He's been a kind of a role model for me. Kind of taught me how to relate to people, to patients, and then the importance of a combination of good clinical knowledge and communication to find a way to really release the burden, psychological burden, mental burden, also beside the physical burden that sometimes a medical condition brings. So this is why I kind of see medicine as the best way for me to really impact and make a difference and give my contribution and serve the community. That was also a pretty early decision. So I remember very clearly I was in medical school, and yes, I was going through my cardiology exams and studies. And yeah, it was fascinating how the heart, the cardiovascular system work. I mean, it was an amazing clockwork. And I can tell you more. I actually started quite early to think that I would like to be in interventional cardiology. And the reason being that, yeah, I kind of was fascinated by the ability to improve quality of life in patients coming, for example, with an heart attack. I remember when I was, again, a medical student attending my first invasive angiogram. I was really fascinating about the ability of these new techniques to dramatically change, again, the life and quality of life of people who were coming in with an heart attack. Everything was done in a very short amount of time, keeping the chest closed, so there was no invasive cardiac surgery. Yeah, it was fascinating. I kind of told myself, yeah, this is what I'm going to do. I would probably say two things. So the very first one is that feeling of fulfillment at the end of an emergency procedure. That feeling of fulfillment that comes from the awareness that you might have made a difference for someone, that you might have been of help and service from someone. And the second aspect is a direct consequence of that is kind of the smile and that feeling of relief that you can see in your patients or family members, where you go to them and say, you know, we found the issue and we've sorted out. Yeah, that's very rewarding. I would say, I mean, the feedback I get from patients are usually about professionalism, but what really I think probably might make a difference is my approachability, my kindness, and the time that I spend with them. And this is something that is very much rooted in my belief. So sometimes I feel that the feeling of uncertainty that comes when you have a medical condition always is very much strictly related with your inability to understand what's going on, what's wrong with me, what is going to happen with me next. And this is why I tend to spend as much time as possible to discuss with my patients, to use easy and lay terms to understand exactly what's wrong, what are the mechanisms behind the medical condition, what are the possible scenarios. And I have always the feeling that this is kind of very help to deal with that. And so knowing what is going to happen next, of course, remove that psychological mental burden that is always associated with the medical condition. And what I value of my patients, well, they are the best teachers. I always learn something from them. And most of all, the importance of health, life, and time, which are amazing values that we should truly value and treasure. Yes, I do actually. And I was at medical school again, and one of my tutors at that time, he told me these words saying, whatever you do in life, make sure that in 20 years from now, you are not doing things exactly the same way you're doing today. And this is, for me, is something that I keep repeating myself, and is a kind of push me to strive all the time for improvement, innovation, and perfection also, even though I know they are, especially the last one, is not really achievable. But this is something that I really I try to reflect and in my passion, in my daily clinical care and clinical research.